In today's video, I'm gonna show you guys a new place option to take care of your health here in Orlando, Florida. My name is Patricia. Welcome to Travel and Health. We are going to visit it now, an urgent care that is located just 10 minutes from the MCO airport. Let's go. Guys, this is AJ. He's a manager and also the provider here. Say hi to Brazil.
Hello, hi Brazil.
AJ, first I want to tell you, I'm pretty sure this place will be a success because I know how a great professional you are.
Thank you.
We worked together some time ago, and I know if you come here, guys, you're gonna be in a good hands. Let's talking about this place, the ER care. What is the difference between this urgent care for another's urgent care?
Well, like you said earlier, they don't have me. And second is ER care is a different type of facility. It's not a standard urgent care where you're gonna wait 2 hours and then you pay them, then they'll see you, then they tell you to go to the hospital.
Mm-hmm.
And in our place at ER care, we do everything in-house. So we don't send our patient to the hospital unless it's absolutely life-threatening and necessary. Our goal is to keep our patient outside the hospital.
This is very important. This is very important, guys.
Healthcare is very expensive.
Yeah.
What they do in the hospital and emergency room and what we do here. The cost difference is huge. So our self-pay price is $150 per visit. If you go to the hospital and emergency room, they'll charge you at least $1,000
Yeah.
for that same visit. We have a concierge service for the patient who does not have health insurance or they cannot afford it. So, for example, let's say you don't have health insurance, but you need somebody who can help you while you're in the U.S. And so our package works is $250 per month. You have 4 visits included. You can come to our clinic 4 times, or you can do telemedicine 4 times.
This is a good deal.
If you have laceration, we're gonna stitch you up. That's included. If you got an infection, we're gonna drain it. That's included. If you got a
That's all included.
yes, if you got a broken bone, we're still gonna see you for that. So any acute injury, illness, or your well visits are included in that package.
What about the age? Do
We
you
can-
treat kids here?
Yes, we see anybody 3 months and up.
Oh, this is nice.
Yes, and we have a
Because we have a lot of families that from Brazil, they come and visit Orlando,
Okay.
and they don't know where to go if they need. Né? They have
this
kids.
is
You can come here, guys.
This is the perfect place. It's a one-stop shop. We have X-ray machines that we can do X-rays on small kids, adults, even babies. We have a facility for IV hydrations if somebody's dehydrated.
Let's know a little bit more about him.
All right. Well, as I'm sure you know my experience based on we worked together in the past. Obviously, I was born back home in India. I came here, I was 15, and I graduated school in 2001. And I have worked in a level 2 trauma center and surgery. I have worked in emergency room all my life, including Advent Health, downtown Orlando. There used to be Florida Hospital before.
The most important thing to tell you guys, he care about the patients.
Yes, so I mean, when a patient comes in sick, I make sure we spend enough time with them to help them and take care of their problems, instead of just telling them to go to the hospital or go to emergency room. Even sick people, if they go home from my clinic, even from my previous job, if they go home from the emergency room, I have called them a day or 2 days later to check on them, make sure they are doing okay.
I know that I saw you doing this many times.
And
This is hard. This is hard to see nowadays.
And I usually use my cell phone to call them,
Really?
not a office number.
You have seen a lot of Brazilians here?
Of course, I mean, my previous job, I saw a lot of Brazilians at different locations.
They can come here.
Of course, they can come here and feel like a home. They're going to be treated like a family.
If you need, you can call me. I have a family from Brazil here, Patricia. Can you help us?
I will call for translation if I need to.
I'll be here every week. We're going to talking about health here in the channel.
Of course. Yeah, we can talk about what's coming up next in the pipe, monkeypox, and possible flus coming back. This is a typical room that we have.
Oh, this is a good place. Everything is new.
Yes, everything is brand new except me. And,
oh, AJ.
we have every room is set up like this. Total of 7 rooms.
Do you have X-ray here?
Yes, we have
EKG.
we have EKG, X-ray, and ultrasound on site.
And what about the service?
Services, we have in-house labs, which you can see here. That's a complex CLIA lab. We have primary care services, family practice, pediatric care, all the emergent services.
Health,
mental services. This is probably the only place you can walk in for mental health services on a Sunday. And the mental health services, we see any age, older, younger, middle age. If you have lacerations, we fix that. If you have abscess, we fix that.
And you guys open here every day?
Every day, 7 days, Monday to Friday, 8 to 8, Saturday, Sunday, 10 to 5.
Okay. Let's see.
Yep, let's take a look. This is the portable X-ray machines.
Oh my God, this is so nice. Look at this.
We can wheel this machine to the patient room if patient doesn't walk. They can do standing X-ray as well. This is the PAC system where we send the X-ray to radiologists to read it so they can give us a final report.
AJ, can you tell us about the tests? What kind of labs do you do in here? About the time, is fast or no?
Sure. So we have a complex CLIA lab, as I told you earlier, that requires a different licensing. In the test, we have blood cultures, we have COVID PCR, we have monkeypox testing. We also have molecular rapid COVID test, which is results in 15 minutes and almost 99% accurate checking the COVID-19.
What about the test you told me for the heart?
Heart, yes. So we have the heart test right here.
This is the machine?
This is the machine. It's called Triage that can do tests for the heart attacks, blood clots, and the congestive heart failure. 15 minutes, we will know whether a patient has a heart attack or not.
This is very important, you guys, because here in the United States, the health care is very, very expensive. If you can avoid to go directly for the hospital, it's better, no?
Yes. This machine will check for the kidney and dehydrations. The results in 15 minutes. It's checked for infections. So if I do a COVID test, flu test, strep test, urine test, and I don't have any reason why patient has a fever, then this is the test I do. It's called CBC, to check for white cell count, check for hemoglobin, and check for any bleeding disorder. This machine will tell me in 15 minutes. We have an IV hydration setup. We have 500 ml bags, we have 1 liter bag. We have different size catheter based on the size of the patients. We can place the patient in the room with a blanket for their comfort up to a couple hours.
Okay.
And get them hydrations.
Okay, AJ, thank you so
No
much.
problem. Thanks for having us.
Guys, you know, you have a new place here, you'll be in a good hands.